I suggest my patient to be cool. And I say that they'll come to me with saying that I have a lot of stress. Then I suggest to them, accepting that you have a stress itself is a big stress you are creating in your body. Don't accept that there is a stress. You are cool, you are normal. Say 10 times or 15 times or 100 times per day that you are good, you are cool, you are happy. If you are conveying these information to your body in other subtle mind, then automatically things will settle down. If you are accepting that there is a stress, you are and some new corner of mind, you are feeling that you are not well, you are not right, there is some stress and you want to overcome it, and then unable to overcome that stress, then you are feeling in a depression and leading to lots sort of stress related issues and diseases. So first thing is, in my approach, usually I suggest my patient to don't say that you are having stress. Whatever it may be, let it be, but don't accept that you are having stress. Be cool and say that you are fine, you are happy. If you repeatedly say that you are cool or you're happy or nothing, there is no problem as such, then everything will settle slowly in their line. So that is the reason my approach for this type of things is that don't accept that there is a stress. If I accept that there is a stress and I make them to feel that there is a stress to try to overcome it, then every time he goes on repeating that with quantumizing this, whether the stress has reduced or not, something like that. So when stress is not there, then there is nothing to be reduced or increased. So you go in that approach is what I usually counsel my patients in that way. And it has given me results also many a times. But of course, handling these type of stress related things is not so easy. One sittings they will come back with a happy note that saying that everything is fine, everything was fine. But for the next sitting, suddenly they come with no, my stress has increased. So these are quite common in a what is called psychosomatic disorders. So we need to understand that physiology and pathology, and of course, counseling has a very important role to play here to relieve the stress so that things can be set it right.
And you said that Agni correction is very important. That sets the Pitta in the right, at optimum levels, which addresses both the physical and the mental components. But sometimes it so happens that some clients with anxiety or depression, they will have increased hunger. They'll be eating more, but still they will be having depression or any underlying psychiatric problems. So how to address there where Agni is apparently pathologically high?
When you are supposed to bring a change in the mindset of a patient, we need to initiate or trigger a new point in his brain. He comes to us with all his history and he will be giving the details that how he is feeling, what he is doing, and how his weight has increased and how his voracious eating has increased because of this, and he is feeling depressed, so many things. But in that situation, I try to put it a new point in his brain that see, with this there is a new problem, and I make them to feel you just concentrate on this part. Like example, if you are eating more, see your body weight is increasing, you have to reduce your body weight, you start walking, you start jogging. So reduce eating this type of and reduce the quantum of intake by measuring the things. So like that, I'll try to move on to the counseling part and reduce their intake and all those things. Of course, it takes some quite a number of sittings. It's not simply happens in one sitting. So this is the way we need to counsel them and address those tiny issues associated with that. Then slowly it comes into the right way.
While you were teaching us back in BMS, you were explaining about a doctor who would for any kind of conditions that the doctor would go for anulomana first, because there can be avarana, or there can be struck doshas in the stomach, or blocked srotases. So anulomana as a primary way of treating, as a primary thing, and then the other disease-based medicines are given. So probably even that strategy would also work in stress also.
Definitely, because we all know that in our body, Vata is the one which is having the capacity to move from here to there, and even the capacity to carry the things to other places. Even the kapha, pitta, or whatever other things are, they are all lame. They can be moved by the influence of Vata. So that's why even many a times in many diseases we find that Adavanta Madhyecha Marutam Paridakshitaha, it is said. In the beginning or end, try to maintain the Vata. Vata is very important. Here also, if Udana Vata, Apana Vata has been made to move in Apana direction, automatically rest of the Vatas will be doing their function normally. If Apana Vata moves in Urdhva Gati and becomes Udana, then everything will settle disrespectful manner, and the things will go in a very varied things, and patient will have lot of issues. So first thing is we need to make a way for that Apanavata Pradesha to be clear, and continuously it should be in moving in a right direction. So Apana should be made Apanugataha. That's the reason I used to say that Anulomana should be the right choice. And usually whenever the patient comes with Pittaja disorder or Vataja disorder, usually this is a very right way of doing it. Anulomana as a part of the therapy, if you introduce it, then slowly the things will settle down. Even the kapha will come to play in the later part of the treatment. But first in the beginning, Vata, if it is addressed properly, then followed by that Pitta, and automatically kapha also fall in line.